Welcome to the Scale Up Valley podcast, where we bring the best founders and investors to help you scale your business from 1 million to 1 trillion. Today's guest comes from Tel Aviv, Israel, but also present in the US. His name is Boaz, the CEO at Wisdo Health. Boaz, welcome to the show.
Hey, Mike, thanks for having me.
A pleasure. And you have an amazing story, an amazing background, and better than myself presenting you, what about sharing your story with our community?
Happy to. So hi, everyone. My name is Boaz. I'm the founder and CEO of Wisdo Health. Wisdo is a social health company. We improve people's health by making sure that they're introduced to the right people online. And make sure that the connections that we recommend indeed improve their health. Very happy to be here.
Sounds amazing. And I know that what Wisdo is today have been through multiple iterations until you got here, as in any startup. But maybe just to give a context for the audience, where are you in terms of stage of growth? Any metrics that you can share? Any funding rounds, etc. Just to give a little bit of context. Head count, if you can disclose those kind of things.
So I don't know how close we are to a trillion, between the million and the trillion.
Exactly.
We're like most companies, we're somewhere in between.
Exactly.
We believe at an exciting junction, because we're really at that moment of a really an interesting inflection point with healthcare in general, trying to find platforms that can help people move away from loneliness. So we spent about almost 2 years working with major leaders in health, primarily Humana, which is an exceptional health insurance leader who was interested in piloting the effectiveness of our our platform. Those results are published this month. So we're out there promoting a white paper that demonstrates a massive reduction in loneliness, in a massive increase in quality of life, and opportunities to refer people to additional services that they might not have been ready to take a look at if they were still lonely. And because 60% of Americans 50 plus are sometimes too often lonely, which is a staggering number, we're really experiencing a lot of incoming of companies who want to make sure that they can sponsor members onto Wisdo and address that problem, which is devastating to people's health, but also devastating to the overall cost of healthcare. Yeah. So we are at that point where we're signing new deals. Hopefully, we're going to end the year with 4 or 5 new relationships and a few millions in annual revenues, so we can really continue to build a company and solve this problem, which we believe is very urgent.
Yeah. So you have both thinking about the pain, which is to solve or address the pain of loneliness and the consequences of loneliness that people typically think about just mental health, but there is also physical health as an impact on that, and of course the costs of healthcare, as you were saying, right? So and your platform has some quite unique approach to solve the problem, right? And namely ensuring that you are able to be paired with the right person that has been facing a similar issue as you are facing today, without having kind of the social media buzz or distraction. But maybe you can explain much better than myself.
I can try. Yeah. So the good news is that there's a realization, and very honestly, the COVID crisis really accelerated the understanding that there's mental health, and there's physical health, and then there's social health. So if you are not surrounded by people, and it doesn't matter if it's online or offline, that you can speak honestly to, that you can confide in, that you can ask for support from.
Right.
And even if they're not people around you that you can help, then you will feel lonelier than needed, and then that is going to affect your mental and physical health. And that has been proven in a multitude of use cases. The problem, of course, is that loneliness can only be solved by other people. It's a human interaction versus an interaction with a bot or an interaction with a professional, if it's a psychologist or something else. Those things do not necessarily reduce loneliness. What reduces loneliness is a human being who's able to sit down with you and say, I understand. I've been there. I'm sure there are a few entrepreneurs on this call. So imagine that you're going through a crisis as an entrepreneur. You can't raise money. You're the best engineer has just resigned because he's got an offer from ChatGPT, and it feels very lonely. Now, a psychologist is not going to help. Your mom is not going to help.
Right.
An online program is going to help. The only thing that's going to help is if Mike is going to say, hey, there's this guy that went through the exact same thing, and I really want you to have a conversation with that guy. And that can be replicated to any life experience. It doesn't matter if it's starting a company, going through anxiety, building a house, getting divorced, going through weight issues. That human component that was always part of the human experience, for some reason, has been neglected over the past decade or two, and even worse, has been left to platforms that were not originally built to solve loneliness. They were built to, social networks were built to raise engagement, to sell ads. I mean, these are ad-driven platforms. They're not a healthcare product. So that gap over the years has gotten bigger and bigger. What we are trying to do and are doing is taking a more scientific and measured approach to figuring out who are the people. And it's not one, it's not two, it's probably a few, dozens of people a year that we think that you should chat with and add to your support network, because they answer to three very important criteria. One is they've been in your shoes. So somewhere in the world, there are people who are like Mike, people who, if you met them on the train and you would spend 3 minutes introducing yourself, you would say, I don't believe it. It's like, we've been living the same life. And chances are that you and that person is going to have, or you're going to have a wonderful conversation for like 6 hours on that train. Yep. So we know how to find those people. There's a method that we use where people kind of map out themselves and then are matched with people that we think that can be helpful to them, because again, they've been in their shoes. The second, and very importantly, they've been ranked as helpful by other people on the platform.
Got it.
So people are not ranked by how popular they are, how attractive they are, how many followers they have, all that really interesting information that means absolutely nothing in the worlds of social health. That's the second criteria. And people on Wisdo get the opportunity to rank and rate the level of conversations that they're having with other people. Yeah. And lastly, people are engaged. People who are there. If you're going to reach out to someone, chances are they're going to respond fairly quickly. So you will not feel as if you went through all the trouble of reaching out to someone and that person is not responding. So we know how to make those connections. And then the last part, which is pretty important in healthcare, once a month, we invite people to check in and answer a list of questions, which are taken from what is today the standard measurement for measuring loneliness. It's called the UCLA scale. So people answer those questions when they join. So we know if they're not lonely, if they're lonely, or if they're severely lonely. And then once a month, we bring that check-in again, so we can see whether the connections that we've been recommending, are they indeed helping that person move towards social health? And if not, we'll make some adjustments.
Right.
So that is really the approach that we took. From a scale point of view, we talked a little bit about this previously. There are two kind of I'd say schools. One is create an MVP and then run as fast as you can, and raise money and
Right.
grow the business. You will figure it along the way. We kind of took another approach, which is, and I don't know what the right approach is, but we spent years on perfecting this. And this is like 5-6 years of improving and improving and improving the product, and then starting working with healthcare, and then introducing the measurements, and then publishing some white papers. And now these white papers are going to be published in peer-reviewed magazines and publications. And now we're trying to share more with some other folks and tell our story, so we can accelerate our scale up.
So you kind of have been focused on building the best product in the market to solve this problem, right? So that was
Correct.
your initial focus, or number one priority, and ensuring that the product worked to have high engagement, retention, before moving into more B2B2C and understanding who would be paying for the service. Because maybe that's some of the questions that the audience might be asking themselves is, so how the business model, and usually in healthcare, it's always much more complex because you have a lot of the stakeholders in the process. So who is using and who is paying might not be the same person, right?
Yeah, so we started, like many other platforms that ended up identifying an opportunity to work with healthcare. We started as a consumer app. And that is why as you said, we were so focused on engagement and retention, all these things. And we were, we did have a subscription kind of framework in place, and there was a paywall. And our view is that if people are happy to spend or willing to spend whatever, $20 or $30 or $40 a month on anything between Netflix and Noom and other subscription businesses,
right,
then a sense of healthy connections is going to be, over time, something that people would prefer to pay to make sure that they do receive the quality connections that we know how to make. And we were on that route. COVID really changed our strategy in that respect, because as soon as loneliness became something that Vivek Murthy, the current Surgeon General, likes to say that loneliness is as urgent and as prevalent in the US as smoking and diabetes. And he came with that view into his position as Surgeon General. So suddenly everyone was talking about loneliness. And since there's a realization that loneliness ends up costing quite a lot of money, AARP has done some work on quantifying the added cost of someone who lacks what they call social protective layers versus people who are older and do. And the number that they ended up coming up with is $6,000. So a person who's completely lonely, completely vulnerable, doesn't have supportive networks, is at risk of costing $6,000 more than an older adult that does have access to these type of networks. That's the work that United Healthcare and AARP did. And then Cigna did a similar investigation into the added cost for people who are employed Americans, people who are younger, and they came up with a number 4,200. So as soon as there's there became a realization that loneliness is a very costly problem, and this needs to be solved, then the only question is, can we as a healthcare organization, an insurance company, employer, etc., can we partner with platforms that can demonstrate that they help people feel healthier? So chances are that using the right measurements, this would predict a cost in medical costs? And if so, is the reduction in those measures big enough to justify a certain price point? And we've been able to show using these two measurements, UCLA and another one called Unhealthy Days, both of which are closely connected to cost in multitude of studies, that we can reduce them within 90 days to a degree that makes it financially compelling to companies pay us anywhere between $100 to $180 per member per year. And since there are 111 million insured Americans who are lonely, then suddenly we became a really interesting proposition from a business perspective as well.
Got it. So I imagine that's your typical go-to-market for health tech. It's also employers and insurance companies that you are selling to, right? So,
yep.
And that's why you also need to have all that evidence, those numbers to be able to go through the process. And it's also kind of an enterprise motion in a long sales cycle, right?
Very long sales cycle, but a sales cycle that doesn't have any chance of succeeding unless you have some proof that you work, and unless that proof is based on, again, measurements that the market, and by that I mean not necessarily the financial people, the P&L folks, or the people who are looking at this as a financial issue, but the medical professionals identify as measurements that indeed, if you're able to move them, then you are helping, you are improving people's health. So one recommendation that I can share with people on the call is that if you are in healthcare, or if you have a wellness program or a wellness product and you're trying to sell it to employers and to health insurance companies, it's worth really making sure that the measurement, that you have measurements, and it's not only, hey, do you love our product? 1 to 10, yeah, we love our product, great. No, you will have to introduce measurements that are universally recognized as indicative of someone moving towards health, and then you will have to prove that you can improve those measurements over time, and you will have, unfortunately, to try as much as you can and do it again and again and again until the product is ready to be shown to some other folks. Otherwise, it's going to be a really good conversation, but it will, in all probability, lead nowhere.
Typically, in these cases, and you might want to relate more to your own personal experience, because every single company has its own specificities. Did you start with employers or health plans? What do you think it's easier to start with when you are moving into this B2B2C motion?
I actually would recommend, if you have the stomach for it and if you have the runway for it, etc., I would recommend starting as a consumer app. And even if you want to end up becoming a healthcare product. And the reason is that companies who, I mentioned Noom is a good example, and Headspace is certainly a good example. Calm is a good example. The most successful companies out there that are able to sell to employers or insurance companies in a B2B2C cycle are companies who previously spent years on trying to perfect the user experience. And the reason that that's important is because one of the biggest problems in healthcare is engagement. If you think that engagement is low for just the general population who downloads apps from the App Store or Google Play, imagine what happens with someone who is ill. Engagement levels are even lower. And if you're a healthcare provider, one of our advisors and supporters is Tom Insel, who used to be the director of the National Institute of Mental Health. And he says often that the biggest problem in healthcare is lack of engagement. You have all these tools, but no one is picking them up. So if you are able to step in and say, here's what we do, here's evidence that it works, but also, you know, from the 10,000 people who joined in January, you know, 8,000 are still there in, you know, April, then people would go, wow, that is really interesting. Because really, from a healthcare perspective, what it gives you the opportunity to do is stay close to people's journeys. And if someone is doing this well, maybe intervene and make sure they can veer towards help before, you know, the condition deteriorates and loneliness becomes depression, or you know, anxiety becomes severe anxiety, and you know, someone who had a issue with food insecurity, or you know, someone who's suffering from obesity, suddenly, you know, a year after that, because that was neglected, this has become a life-threatening problem.
Yeah, so kind of start B2C, focus on the product and on the member, on the user, ensure that there is a high engagement, retention, kind of also measure what are those parameters that you can prove that your product is helping to improve the health of your members. And of course, also the ROI calculator when you start creating your value proposition to the B2B go-to-market motion. And in that B2B go-to-market motion, any experience on where is it better to start with employers or with insurance companies or health plans? Or
you know, it depends on what you're trying to achieve. I mean, both have their merits, and you know, and both sales cycles have their challenges. The benefit of the employer market is that usually they move quicker.
Got it.
And there are more people that you are trying to, you know, chat with and close deals with. The you know, the benefit of working with a health insurance plan is that they're very, you know, professional and medical minded. So it's really an opportunity to close. Certainly for us, it was an opportunity to close any and every learning curve that we had to close, because you know, these guys have been looking at this problem for probably longer than anyone, and if you can meet their standard, then that's a very high standard. So if you are able to meet that standard and then you go out and speak to employers, then you know, that gives you added credibility. I think, you know, my advice to people is try to find where there's a natural tie-in between what you do and what either employers or insurance companies are looking for, because it's going to be very difficult to cheat you know, that process and say, well, you know, really we're doing something that is more interesting for employers, but I've decided that I'm going to try to sell to insurance companies. It's sort of, you know, if you're helping with productivity, and your product that is only effective in people who are younger, then chances are that employer is going to be a more natural place.
Got it. Makes a lot of sense. Still on the go-to-market component, we have a lot of cases of a lot of success cases of Israeli companies expanding across the US. Do you see Israel as a pilot market or just as the tech hub and expanding from day one to the US markets? How did it work for Wisdo?
So, you know, Israel is a really good place to start a company because there's a lot of innovation. People are stubborn and
resilient.
Yeah, they're resilient, and you know, they've gone through a thing or two in life before they started the company. You know, they're not straight out of college. You know, chances are they've been in the army. You know, they're a little older, and you know, they're very kind of determined. At the same time, it's a small country. So you know, I think the dynamic is if you start something and it works, then you know, this is a very, very small market and everyone speaks the strange ancient language called Hebrew. So, there's never going to be enough people in Israel to support what you built. So the natural dynamic is you start something, seems to work, and then you say, okay, so how do I, where do I go with this product to find enough people who can really, make this work? And then, people eventually migrate into primarily the US, because I think, the US and Israel have a very strong, two-way street in terms of investments. So, that is what usually happens.
Right. And typically in your case, did you consider East Coast or West Coast to start with?
Well, we from an investment point of view, we ended up being more, attractive to West Coast investors. This is a big idea, and it's something that West Coast investors were attracted by when we started out. East Coast, yeah, you're right to maybe imply that East Coast usually is more kind of healthcare minded, but East Coast are very, very ROI, very revenue driven, which is fine. But when we started out, we just had a kind of very, very compelling story and a very effective pilot. So we ended up connecting with a bunch of healthcare investors who are value based. Then as the companies evolved, we ended up attracting some additional investors from the East Coast as well.
Got it. Makes a lot of sense. And we know that this is one of the main challenges of leading an health tech company or digital health company, is to be able to have a kind of a B2C and a B2B mindset at the same time. So it's almost usually in startups in general, outside of health tech, we would say you need to decide if you want to go B2C or B2B. It's very difficult to build a team that has skills to do both. So you need to go for one. And in health tech, we need, even in the B2B2C model, we need to be able, as you said, to have a product that has an amazing UX, UI, an amazing experience for the users. And of course, at the same time, understand how to navigate the complexity of the B2B enterprise deals. And at the same time, you still have another component, which is all the healthcare jargon and understanding the system, understanding that evidence. So for an entrepreneur that is trying to build a startup and scale it, it's a huge challenge to start a digital health company. Any lessons learned becoming, maybe also because you followed more the B2C approach kind of as a lab before evolving into the B2B2C model. How has been your experience building this healthcare executive in you?
Well, it's not easy. And I think people who expect this to be easy are going to be surprised. Because it's not.
At least.
Yeah, to say the least. So yeah, I can offer some insights that I wish someone would have told me. I think that don't forget that that at the end of the day, you're going to be in the hands of a person. So even if you're selling to, companies who sell B2B, like pure B2B, like, whatever platforms who organize, appointments and that type of stuff used internally within the healthcare organization, that's another story. But if you are, at the end of the day, going to be in the hands of a patient, in the hands of a member, then that really is what's going to matter. I really, a firm believer that if you are able to produce something that would get the end user excited, and he would go, wow, this is really cool. This is great. I really am enjoying using it. Then all the rest of it, somehow, if you don't give up, and if you're stubborn, and if you're resilient, all the rest of it is going to somehow sort itself out. So that is one thing that I would say: find great product people. Stay close to the data. Act as if you're a consumer, B2C guy. Look at conversions, look at retention. Talk to users. Ask why it's not working. Forget about the payments. Just concentrate on the experience. And actually, I don't want to mention names, but I know a lot of healthcare companies who closed, including companies who raised north of $100 million because
Wow.
that part of the business got neglected. I'd say, another insight is probably there's going to be a lot of turnover in your company. When you change from B2C to B2B2C, when you're moving from,
right.
It's it's going to create some anxiety internally.
Right.
So and I think people will say, well, communicate that to the team and be a leader. Yes, all that is great, but people are going to leave. So I think if you can identify at least 2 or 3 people that are core, and keep them and be honest with them, and make sure that you can turn to them, then that's going to be really important, because otherwise you will crash and burn. You can't keep everyone. You have to keep yourself. You're very important to the company. You have to have these 2, 3 people that you can talk to, that you can rely on, even if it's not a co-founder, even if it's a senior person, someone that you can trust in those low moments. I think that's really, really key from my perspective. Make sure you have enough capital. Make sure that you don't run out of money. Be very capital efficient as much as you can. All of us are always going to run into runway issues sooner or later. It doesn't matter how much money you raised. Everyone needs more money, more runway than they have. But I think that's also very common to Israeli companies, for better or worse. We're very, it's very hard for us to wrap our heads around the idea of, hiring a huge complex and spending a ton of money on PR and a ton of money on this and ton of money on that. We're much more lean in our, DNA. So even if even if your board and investors are pushing you to spend more money, if you believe that is not core, then be strong enough and honest enough to turn to them and say, no, I'm not going to do this. If you want to write me a check now for $5 million, so I can do this, great. But I'm not gonna, I'm not gonna run out of money in 6 months because you think it's a really good idea to hire, the former designer of whatever, the Apple Watch. No, we can't afford this, and we're not gonna do it. So those are 3 insights that I wish someone would have maybe told me earlier on.
Amazing insights, Boaz. And do you have a co-founder, or are you a solo founder?
I used to have several co-founders. We separated along the way. And today I have, a very strong and very, trusting team. I can name 3 or 4 of them that I really, view as people that I trust blindly, even if they're not co-founders.
Right. Sounds great. And in terms of of course, you were saying that it's pretty important to always having a runaway and having money in the bank. Any fundraising lessons especially now in a rocky market?
Yeah, I mean, just don't treat it as something that you're forced to do. It's essentially, when you're asking people for money, and it's not easy to do, and it's not fun to do, because you're gonna get a lot of no's. But you're asking people for money. If I would come to you, Mike, and I'd say, hey, listen, I need $100,000. I have a really good idea. It's like, well, why do you want me to? It's like, you're asking people for money at the end of the day, and put yourself in their shoes. It's not easy. So, be respectful of the fact that you're asking people to gamble on you and your idea, and give them credit by trying to prepare the best pitch that you can, tell the best story. This is not something that you want to try and get done as quickly as possible, because you really can't wait to go back to the company and do what matters. No, that's not going to work. You have to treat this as if this is an important part of of running a company. These are smart guys, and they've seen a zillion pitches. And one asset that I can recommend for people who are interested in getting better at pitching, there's a book called Pitch Anything. I think the guy's name is Oren Clough. He talks about how simplicity is really the key for telling a good pitch. Instead of we have since we're all data and specific detail oriented individuals, we have this illusion that if we come into the room and bombard people with information, and they'll get convinced that we're right.
Exactly.
But that is not the way to do this. You have to walk into the room, essentially say, everything is okay. I'm not threatening you. I'm not going to bombard you with information. I'm just going to tell you a very simple story. I'm going to tell you things that you know already. There's this problem. We're solving this problem. Here's how we're solving this problem. Here's what people are willing to pay. I believe this can be big. We're raising this and that. I think it makes sense. What do you think? And that's it. And that's it.
Sounds great. And it also relates with your background, right? So you started as a journalist, and then you started building companies after that. Can you share a bit more? So that's also, it helps you to articulate well your story.
Yeah, I think storytelling is key. I was a journalist for 20 years of my life.
Amazing.
Loved it. I still miss it. Still, write the odd story when I can't contain myself. But I think I tell this to my journalist friends who are, unfortunately, in many cases looking for jobs, because journalism used to be a very thriving industry,
right.
And over time it kind of ran out of money and ran out of business models. But one thing that journalists, or two things that journalists have in common with entrepreneurs, one is they're scrappy. So it's like, go and bring the story. There's a guy, and it's really like that. This guy, just heard a tip about this guy, has an amazing story. Try to get him. It's okay. So, but how? I don't know. Good luck. And you have to somehow make it work. So journalists are scrappy and entrepreneurial in that respect. And they learn to rely on their instincts, and they learn to not to count on resources or the ideal circumstance to bring the story. So that, I think, is something that entrepreneurs and journalists have. And I think the second thing is yes, the storytelling part really the storytelling part is figuring out what is the minimal, the minimum version of what you're trying to tell. Because again, if I'm out there, if you're spending a week shadowing whatever Joe Biden, or your editor sent you to spend a week on a White Lotus like hotel in Italy, if you're very lucky. You can't tell all of it, right? If you had to tell all of it, it would take, you had to write like 15 books. So what you do as a journalist, you try to distill the minimum version of what you need to tell for people to understand the whole experience. And that is really what we often do as entrepreneurs when we hire people, when we raise money, when we do podcasts. I can't tell all of it, but I can try and tell a version of it that would be simple enough and distilled enough so people would get an idea of what the bigger structure is. So yeah, if you're a journalist and you're out of work and you want your life to become even harder, become
That's a great pitch.
Yeah, there you go. I know I stole it. I know people are very eager now to do it.
Exactly. And let's go into the last segment of the show, Boaz. If you'd have the opportunity to meet yourself at the beginning of Wisdo in 2016, what advice would you offer to your younger self?
Yeah, well, when we had this conversation earlier, I told you, run, but no. I'm sure you get this from a lot of people. I would say to myself, listen, this is going to be a long haul. So take a deep breath and prepare yourself for a very long journey. It's going to have highs, it's going to have lows, but you're doing it for the right reasons. You're not doing it for yourself. You're not doing it for a paycheck, and you're not doing it for to prove something to someone. You're doing it because you went through a personal experience where we can talk about at some point, but I think most entrepreneurs have it. You went through something that was so painful that you decided to try and save that pain from other people. That is the only reason that you're doing this, and that is the only thing that will sustain you during this very long journey. So don't forget that, and don't expect this to be over in 2-3 years. It's going to take a while. So I think that is one thing that I would say. I think in all honesty, I think in hindsight, the team that we had starting out could have been better. And it took a while until there was a match between what we're doing and the people who are doing it. They're all great people, by the way, but not necessarily for this specific company. So I would tell myself, I know that you're at a rush to start, and you want to get this off the ground already, but take your time. Make sure that the people you're starting this with are not only great people and experienced people, but people who are ideal for this specific company. And if you think that they're not ideal, not good, ideal, then it's worth another month, another 2 months, another 4 months on making sure that you find the right people, and maybe you'll stay friends with these guys, and maybe you'll do something else. But for this specific company, there's somewhere out there are people who are ideal for this specific company, and go and try and find them.
Right. Great advice. What are you the most proud of on your journey so far?
I'm proud of our resilience. I'm proud of the fact that we haven't given up. And I'm very proud. I'm mostly proud of the fact that because of the fact that we were resilient, we ended up coming with a product, which is, I'm not objective, but the product is really, beautiful. I mean, it's really something that so much work and so much thought and so much design and so much failures have been invested in this product that it's just, just aesthetically speaking, as a former journalist and as a, there are a lot of books behind me, someone who does have an aesthetic appreciation. I think the product that we ended up building for a very difficult problem is really exceptional. And I'm very proud of that.
Awesome. Worst advice ever received?
Wow, that's a good question. Worst advice. Yeah, well, I can think of several worst advices. One of them is don't say that, or don't open that up, and it'll pass, it'll be okay, keep it in your stomach, don't open that door. That's a horrible piece of advice. Just it's a lot of wasted time and energy that gets wasted, while if it's just, hey God, hey, listen, I want to tell you something, sit down, you're a big boy, I'm a big boy, here, ABC, and let's move on. So, and I can think of several moments where people, told me, well, it's a relationship, don't want to do it. And that was a mistake. I think getting things out of the open is the best way to, to save everyone time. And hire that consultant. That's another bad advice. Hire that very, very expensive consultant because he's great. I think that usually turns out to be a bad piece of advice, because if someone is good, then either try to hire the person or find someone who's a little less great but is willing to commit 100% of his energies on on helping you succeed. And if he's so successful and so talented, then there has to be a way to find a way to work with this person where it doesn't cost so much money. Often when people come in and say, I'm a genius and I'm going to cost you $10,000, I'm exaggerating. I never pay anyone that type of money. Say someone comes in and say, listen, Mike, I can turn you into a billionaire. Just pay me $10,000 an hour. And I work with hundreds of successful companies. And it's like, well, if you're working with hundreds, why do you need to charge $10,000 an hour? Right. So, there's this phrase that I learned from our American friends, coin operated, people who you need to feed. Some of them are good, but if they're very, very expensive and they're working with a ton of companies and they're consultants, I think chances are that they're not going to be so invested and also just the benefit that you would end up seeing from them is going to end up being minimal.
Got it. And finally, the resources. So your favorite book, business or non-business?
My favorite book is a book by an American playwright by the name of David Mamet, who wrote a beautiful book about writing and the art of writing called 3 Uses of the Knife. Recommend that book highly.
Great edition.
Work of genius.
Awesome. And your favorite movie or series?
My favorite series is obviously Breaking Bad. So that's an easy one. And my favorite movie, probably The Goodfellas. Yeah, by Scorsese and those guys.
Right. And finally, your favorite podcast, excluding this one.
There's a podcast by a guy called Jonathan Goldstein called Heavyweight, which I think is really brilliant. Every episode or podcast, there's a someone who's been carrying a load, hence heavyweight, for years. Since they were children, they haven't dealt with that issue. And Jonathan, who's a really funny guy, this Canadian Jewish guy, helps them solve that problem, and it's really lovely.
Amazing. This is a great one. I will check it out.
Please.
Boaz, thanks so much for making the time. It was a pleasure to have you on the show, and you are always invited to come back to share the progress and the next chapters of your story.
Thank you, sir. Really enjoyed it.
And to our community, thanks for being on that side. We keep bringing you the best of the best to make your life a little bit easier as you scale up your company. See you soon and keep scaling.